Okay, welcome everybody to our first webinar. We are just waiting for all of our participants to join, so we'll probably wait for another couple of minutes before we get started. I can see the numbers ticking up over 60 already, so we've got plenty of people interested in this. For those of you who joined, please just be patient for a minute or two until everybody's joined, and then we'll get started. It's a shame we can't get a sense of the time zones where people are joining from. We've got, what have we got here? We've got, it's 7 p.m. in my time. Louise, you're in Perth, so 5 p.m.?
Yep, 5 p.m. here.
Yeah, Terry, 2 a.m. in Vancouver. Yeah. Elena, what time is it with you?
It's 11 in Geneva.
11 p.m. Geneva. 11 a.m. Oh, that's a very civilized time. Fantastic. Carlos, what about you?
6 a.m. Brazil.
6 a.m. Okay. All right. And Carina, with you?
10 a.m. in Portugal.
10 a.m. Okay. Fantastic. See, this is how we respect our European colleagues. We try to find a time that works well for Europe. Sorry, Terry, it doesn't mean that we don't respect our North American colleagues. It's just hard to find a time for everyone. Okay, well, look, it's a couple of minutes past. We might make a start. There may well be a few people who join us as we go, but we'll make a start. So I want to welcome everybody who's joined us for this first in a series of 6 webinars hosted by the Justice Health Unit at the University of Melbourne. Thinking about our responses to COVID-19 in places of detention. I want to start, as is traditional in Australia, by acknowledging the traditional owners of the land that I'm on, which is the land of the Wurundjeri people of the Kulin Nation, and pay respects to their elders, past, present, and emerging. And for those of you on other lands, to acknowledge the traditional owners of those lands as well. I'd encourage you, if you're not aware of who those lands are traditionally owned by, to find that out. The format for our webinar today, depending on the time zone you're in, is to hear 4 short presentations from 4 fantastic panelists who I'll introduce briefly in a moment. And then after that, to have a discussion. And if everybody keeps the time, we should have about 30-40 minutes for discussion. And throughout this whole webinar, we'll invite everybody who's attending to type their questions into the Q&A panel. You can find that at the bottom of your screen. Louise Southalan, who will introduce in a moment as well, will be collating those and doing our best to communicate those questions to the panelists so we can hear their thoughts on those. My experience is that often there are more questions than we can possibly answer in the time that we have, but we'll do our best to address as many of those questions as we possibly can. The session is being recorded, so just so that people are aware, we are recording this session and we hope to make that available for people. So for anybody, panelist or otherwise, who has anything particular that is highly sensitive that they'd rather not be made available in that format, please let us know. But that's our intention. And we'll be emailing a link to the recording after the webinar to everyone who's registered. And we have around 200 people who've registered for this webinar. So I'll be sharing that afterwards. So it's my pleasure now to introduce our 4 panelists. I'll just very quickly share the screen with you. Okay. So to begin with, before introducing the panelists, actually, I just want to again acknowledge the Justice Health Unit. This is the work of a number of people and led by Louise Southalan, my colleague who's you can see on the screen, but involving other people in the unit as well, Claire Chiminello, Claire Keane, Lindsay Pierce and others, and we're very grateful for all of their work. We received some funding support to host this webinar series from the Centre for Health Equity at the University of Melbourne, and we thank them for that funding support as well. as I said, the purpose of this webinar series is to think about policy and operational responses to COVID-19 in places of detention. So far, it's been a rapidly evolving space, and you'll hear from a few of our panelists about the responses from their organizational perspective. And one of the reasons we want to do that is to identify some of the things that have been missing from the responses so far. And from all of that, start to develop some recommendations for how we move forward from here, and particularly thinking about comprehensive, sustainable cross-governmental responses. So learning from what's happened so far, typically things that have had to happen in a very short period of time, and thinking about how we can respond most effectively to COVID-19 in places of detention going forward. It is a series of 6 webinars, 1 per month until the end of this year. This is the first of those 6, giving a global overview. We then have another 5 webinars in each of the subsequent months, and you can see the topics of those on the screen. The second one in early August, focusing on decarceration. Following that, one thinking about rights and accountability, information and standards. A 4th on immigration detention. A 5th focusing on Australasian issues at the region where we're based. And then the 6th thinking about international responses. And everybody is welcome to attend any and all of those webinars. We will be sending links with the details for those webinars, everybody who's registered for this webinar. So please feel free to forward that on to colleagues or friends who may be interested in participating. So with no further ado, I just want to quickly introduce our 4 panelists, and we're extremely grateful that these 4 outstanding and very busy people have agreed to contribute to the webinar today. And they're listed here in the order in which they'll be presenting to you. The first is Dr. Carina Ferreira-Borges from WHO. Carina is a colleague I've known for many years, so an outstanding leader in this prison health space. And the program manager for alcohol, illicit drugs and prison health at the WHO Regional Office for Europe, based at the NCD office in Moscow, but currently in Portugal. Our second speaker is Dr. Elena Leclerc from the ICRC, the International Committee of the Red Cross, and Elena is the program coordinator for healthcare and detention for the ICRC, based in Geneva, and actually able to work from her office today. So great to see. Our third speaker colleague from Brazil is Professor Carlos Magno Neves, with 2 affiliations from the Collective Health Department at the University of Rio Verde and from the Observatory of Social Security and Justice Systems at the Federal University of Santa Catarina. Another wonderful colleague I've had the pleasure of knowing for a few years now. And our last presenter, again from ICRC, is Terry Norris Hackett, who's the regional prison system advisor from the ICRC, based in Manila, but currently back in, I think, your hometown, Terry, of Vancouver. So once again, thank you very much to our 4 panelists. And with no further ado, I'll move on, Carina, to your presentation.
Thank you very much, Stuart, and good morning, good afternoon, good evening to everybody attending this webinar. So I would like to start by saying that it is a pleasure to be able to participate here and to be together with the colleagues in the panel, and also to know that we have a very global audience, and this is, you know, very appreciated that you invited WHO to be here in this panel. So I will be presenting about the policy response that WHO has put in place to address the COVID situation, but focusing on, you know, elements of preparedness, prevention and control in prisons and in other places of detention. So the next slide, please. Thank you. Thank you. So I would like to start by saying that WHO has a website that has been, it's updated every day with information related to COVID-19 issues. It can be related to public advice, so very easy to read, user-friendly information, but also very technical information, which is related to both country specificities and also technical guidance. We also have very often media briefings, which are very interesting because they allow also to explore some of the upcoming, questions, and these are questions from journalists from all over the world. So it is very interesting also because they're they cover a lot of different issues, and they provide very good information also for the public. We have a dashboard that allows also a very quick follow-up on what is happening in countries. And the reason this is important is because we cannot have policy responses, or we cannot have, interventions in countries without understanding the context within these interventions. So it is extremely important that we understand, for framing the type of responses that we are selecting in a specific setting, in a specific country, or even, I would say, in a specific region of that country, to understand the context within, the scope of that response. So next slide. This is an overview of the technical guidance that we have collected and that we have published in WHO. And as you can see, it is linked to both the preparedness response, but also to some other more generic, like, mass gatherings guidance, and some information also on related to human resources and to medical situations and technical situations. So next slide.
Apologies.
Yes, thank you. Thank you. It's working. Thank you. So for prison health settings, we have prepared interim guidance, which basically describes what are the actions which are needed in terms of prevention, in terms of preparedness and response in these closed settings. So we have prepared several resources. And the main resource, next slide, is the one which is the interim guidance related to COVID-19 in prisons. So this guidance basically provides an overview of what are the main principles for any intervention in prisons, and what are the main interventions and actions that need to guide those interventions. So we know that prisons are not healthy places. We know that overcrowding is one of the main challenges to address, especially outbreaks of infectious diseases in prisons. And we're talking about COVID, but not only. And I think this is one of the issues that we are going to cover in this webinar, which is what is it that specifically when we talk about COVID-19 is important. And one of the things for us, for WHO, which was important in the COVID-19 situations inside prisons and addressing COVID-19 in prisons, was the fact that this allows us to have a better overview of how the public health system is working in a country, and how health in prisons systems are working also within that country. So it is an opportunity to revisit the system, to revisit the public health response inside prisons, and how this can be changed in order to provide better responses. So we know that efforts to control COVID-19 situations in prisons are very important, because they are going to affect also the efforts in the community. So if we have to address COVID-19 as a whole in a certain community, we need to make sure that prisons health settings are also covered, and they are not left out of the response that we need to provide. So next slide. So some considerations and principles that are in our interim guidance. Again, the measures that are put in place should ensure a gender responsive approach in addressing the COVID-19 emergency in the settings that we are targeting. And this is very important because we know that gender issues are important in terms of, any response for health considerations, but extremely important that they are considered also in the COVID-19 situation. And ensuring also that human rights are respected and that people are not cut off from the outside world and they have adequate information and adequate healthcare provision. So again, the highlights of the human rights, and we know we are facing a pandemic situation. We know that there are measures that are set as important, but we need to be aware that people should have their human rights respected. And this, of course, implies that they need to have access to the information and they have access to the right healthcare provision. We have seen a lot of statements from several UN agencies. And WHO has been involved in those calls from the UN agencies, which have been highlighting the issue of overcrowding in prisons and the need to provide consideration to other types of measures, non-custodial measures at all stages. So the priority given to pregnant women with dependent children, but not only, with people that have other types of diseases is important, as well as other conditions. Again, the COVID-19 outbreak is also gives an opportunity to provide consideration to the increasing number at global level of people incarcerated in countries. So I think that there was a quick response from many countries in the European region who decided to put in place other resorting measures, and a lot of people have been released into different custodial measures, but or different measures, sorry, in the community. And I think this provides an opportunity also to revisit the system and to revisit the types of measures which are in place. And another principle which is important is that we need to allow in prisons the possibility to separate and to have people in different types of accommodations. So next slide.
Just a reminder that we're over time.
Quicker.
Yeah.
Thank you. Thank you. So we have also set up some other interim guidance materials. So next slide, we have provided countries a checklist that allows them to see how well they are doing in terms of putting in place the measures that have been considered by WHO as being important. So this checklist is available online. Any country can use the checklist to assess how well they are doing in terms of, the measures that need to be in place to respond to COVID emergencies. And the link is here in the presentation, and we invite all the participants who work in prison health context to evaluate the measures that they have put in place. Next slide. We have also developed some materials which are linked, fact sheets which are available for people in prison. We mentioned the importance of involving these people in the response, and people need to be informed so that they know, both the people in prison as well as visitors. Next slide. One of the challenges that we faced was the lack of information in terms of outbreaks in prisons. We know that countries have, reporting systems and they report to WHO, but the data is not disaggregated, and we needed to have, to ensure that we were collecting a minimum of indicators for prisons. So we have set up platforms, and we invite again, the countries to provide us the minimum indicators and responses, data regarding prisons outbreaks. And we are happy to support the countries and to come up with specific country profiles that can help them. So next slide, Stuart, please. This is an example of, what we can do with information that is collected from countries. So this is a country that has been reporting to us, and we can see that, there's been a huge decrease in people in prisons over the weeks of the pandemic in that country. And also, we can see and trace this decrease of, cases, suspected cases, but also people that were tested positive for COVID, not only people in prison, but also the staff in prisons. So we think that this is a very important mechanism that will support countries to be accurate in the response that they put in places in prisons. And again, as I mentioned, the links are available, and we invite everybody, who has responsibilities in these settings to contact us and to work with us so that we can better support. Next slide. So what are the lessons learned is that, we do have an issue with overcrowding. It's not on COVID-19 related issues, but also in other health related issues, and of course in human related matters. So human rights are extremely important, should be considered in any time. And we have learned that coordination mechanisms are a key feature of the response that we are providing in countries. Those countries which were better organized provided the better responses, and they are addressing the COVID outbreaks in prisons in a very positive and very good way. Implementation of measures, of course, need capacity building, need supervision, and need collaboration. And I would highlight the importance of continuity of care. If continuity of care is something which is part of the response in prisons, healthcare settings, the response to the COVID-19 situation, outbreaks in countries will be very easy to put in place. So at all times, I think this is the main message. Public health authorities and detention authorities must balance the public health risk against any operational pressures on prisons and other places of detention. So we need to have a balanced response. We need to know exactly what is the situation, and for that we need to collect the data so that we can have in place those responses, because there are pressures from the security side that need to be taken into consideration. And the better the systems are prepared, the better the countries will be able to respond. So thank you very much for listening to me.
Thanks very much, Carina. That's an amazing amount of work from WHO in a short amount of time. And I'm sure if you'd had more time, there would have been more to share as well. So just a reminder to everybody attending that we have the Q&A window open. So if you have any questions or comments, please feel free to type them in there, and we'll try to get to as many of those as we can once our speakers have finished. So in the interest of time, with no further ado, I'll move on to our second speaker, Dr. Elena Leclerc from the ICRC based in Geneva. Elena, over to you.
Thank you very much, Stuart. And well, first of all, a very good morning, afternoon, or evening to all all the participants and panelists. And I would like to share, the same pleasure with Carina of being here with you today, and it's also a big privilege for us to be here today and to share with you some of the observations that we had during this COVID time. And so let's move forward, Stuart, to the next slide, please. And I would like to start by just introducing you a little bit of ICRC and ICRC Healthcare in Detention. So we are we have healthcare in detention programs in more than 60 countries all over the world. And of course, the COVID response was was done in all these countries. And just to illustrate what type of response ICRC was providing, it was also, of course, about technical guidance and capacity building. We were using and referring to the guidelines that were produced by the WHO European office, the one Carina has just presented. And also, of course, we made some adjustments to, some more practical, let's say, guidance for our colleagues in the field linked to this. Then, of course, providing supplies and equipment, quite significant infrastructural support and financial and logistical support. So what I'm going to present to you now is actually based on the observations that we had during this support activities and response activities. And of course, this information is global, is generalized, and it's of non-confidential nature. So Stuart, next slide, please. The idea is not, of course, to do an in-depth SWOT analysis here, but it's just to illustrate on where we think the strengths and weakness and gaps were. So globally, the prevention efforts were, they were very proactive. They were very timely in the most contexts where we work. So the prison authorities and health authorities, they reacted quickly, and they started to put in place some preventive measures. But at the same time, when it came to the response, and so there were much more difficulties and constraints that we observed, and challenges, and we will talk about them in a minute. But it's the challenges related to access to health care, access to hospitals, different the allocation, adjustment of allocation of resources and human or financial, etc. So they were maybe these two dimensions that I just wanted to highlight. Next, please. And when we will be looking at the key challenges, I think it's interesting to look at through the lens of the health system framework. So talking about governance and leadership, well, what we saw the key challenge was there in this area was a little or no expressed commitment by the political leadership in many countries on COVID-19, and of course. Expressed commitment, it's not the only indicator to assess the political commitment, and of course we don't encourage or invite you to use only that indicator, but it's what we have today, because we didn't have an in-depth analysis yet of this on this indicator. But it's true, it was not that much expressed commitment by the government. There was an interest that quite in some regions quite strong of some media to talk about prison health and to advocate for better, stronger response in prisons. But yeah, so from the authority side, we didn't hear much, and of course this had and may have had repercussions on the whole government response to COVID in detention. As you see here, it was also a struggle to ensure a coherence and integration between prison and public health systems. And I would say it was a global struggle. There were no one particular country or region that was affected. And of course, what we noticed as well with COVID, that not all countries were equipped with a coherent contingency plan to fight epidemics or outbreaks in prisons. So this lack was really became more visible and obvious during COVID time, and I think it will be one of the lessons that we need to learn and to be prepared better for the future. So also the limited opportunities for strategies adjustments, because as you will see later, there were not that strong data, I mean, a good and timely data available, so it was difficult to adjust the strategies timely. And as you all know, it was needed because it was very quickly evolving and changing situation, and this I think it wasn't following. Next slide, please, Stuart.
We have about 1 minute left.
Oh la la, sorry for that. So I will be very fast. So as you see, human resources, not sufficient human resources in numbers. The problem was very acute before the crisis. It was again more obvious and more acute because the human resources were diverted and somehow busy with the response to COVID. So again, this really affected access to healthcare in detention, and it was coupled with health and prison staff absenteeism because of the fear and stigmatization. And again, please go ahead with your questions afterwards on this topic, but there were different elements that that led to this absenteeism. It was violence, segregation, discrimination, threats, and so forth. You see it in this line in front. So the next challenges, as I mentioned before, next slide, please, Stuart. It's on, as I just said, it's a health information system. It's also a lack of globally the reliable and disaggregated data for prison health. Some, of course, prisons, they were reporting their cases, and it was integrated in most of the country, we believe, into the national health information system, but we don't have the disaggregated data on prisons, and then the analysis and evaluation and monitoring is more difficult. Supplies of personal protective equipment, as you all know, it was a global struggle and a challenge in prisons and outside. Service delivery, implementation of the procedures in infection prevention and control, as Carina was mentioning, the places of detention are places where, I mean, we have a lot of constraints and in terms of space, ventilation, overcrowding, resources, and Terry, my colleague, will elaborate further on that, but this made the implementing IPC procedures very difficult. I will stop very quickly on the attendance rate, which is not yet in-depth analysis of the situation, but some just trends, and we observed that the attendance rate in prisons was almost 20% less than compared to the time, let's say, before COVID, and this is during COVID, and the same for hospitalization rate. Transfer success rate to hospitals from prisons was in contrary better, and we think that because the system was reacting, and the prison authorities were referring COVID suspect cases to the hospital referral system regularly. And my last slide is about the future, that how we see the future and with COVID and beyond. So what should be done, and we should capitalize on that experience and lessons learned, and use this COVID time as an opportunity to further strengthen prison health systems and to ensure, of course, the equivalent the healthcare access for the prisoner population, to strengthen the monitoring and the evaluation of COVID responses, in particular, specifically, closer collaboration and integration with prison health and national health system. Again, it's a logical conclusion of, I think, of this, the lesson learned. What is important is also, once available, to ensure the access to vaccination and health promotion measures for detainees population, and of course to tailor as well the responses to tackle mistrust and stigma, and which is one of the very important let's say factor affecting people access to appropriate health care. That's all from my side. The last one is just a few references where you can search more about ICRC visits to detainees, where, why, who, and what ICRC is doing in detention. So feel free to consult that sites. And I'm sorry I was a bit late, but thank you very much for listening. And Stuart, the floor is yours.
Thank you very much, Elena. Again, fascinating presentation. And I've certainly got some questions I was hoping to put to you later as well. I know we're getting lots of fantastic questions and comments in the Q&A. Please keep sending them in, and we will definitely get to those after our last two speakers. So with no further ado, I'll move on to our third speaker, Professor Carlos Magno Neves from Brazil. Carlos, over to you. You're muted still, Carlos.
Sorry about that. Thank you, everyone, and thanks for joining us in this panel. What I'm going to bring is some information about Brazilian prisons. The former Minister of Health, around March, they said prison wouldn't have any problem because they are locked. So they are not going out, they are not in touch with people. They wouldn't have any problem about COVID inside the prisons in Brazil. Next, please. Next slide, please. On the news was the National Council of Justice just said that 100% of growth of COVID cases in prisons and renewed recommendation for inmate release. According to the agency's data, in May, there were 245 prisoners with COVID, positive for COVID-19, and today they are 2,212. It was 12th of June, last month. Next slide. 3 days later, that number just jumped from 2,000 to 5,754, and 95 deaths inside the prison. And if you see it right there, the staff is the one who got more positive for COVID, 41 deaths, and the inmate was 2,600, but the rate death in inmate was higher than in the staff. Of course, because the staff, they get a chance to look for better healthcare outside than the prisoners inside. Next slide, please. 1 week later, that number jumped again for 2,000 more, 7,782, 106 deaths. And this time, the inmates number of positive for COVID just jumps. And the number of people who died in that population, inmate population, was 58. And it's just growing. Next slide, please. And the gap of 3 weeks, it goes for around the first news on 12th of June to around 10,000 people inside the prison with COVID and 140 deaths. And that number keep growing, right? The thing is, the staff death rate rised a little bit and the inmates rate just stopped. That number is kind of unsure. How could that? From the beginning, they were dying more inside the prison, and suddenly they stopped dying, and the other numbers start raising. That data make me unsure, and how could I understand it? Next slide, please. It's just the line. Next, please. You can see it's growing in inmates, and it also grows in the staff. It never goes down. It just goes going up all the time. Next slide, please. The next slide that shows is the number. It's from the same agencies, but this data is a bit awkward. I thought it was about the federal prisons in Brazil. We have 1,451 state prisons, which was the first data I showed. And this data I thought was especially for the federal prisons in Brazil, which was 5 prisons. The thing is, those prisons, they can hold 208 people only. It's around 1,000 if we put all them together. They hold 1,000 people, and they say there's 4,863 people positive for COVID. And I thought maybe it's the staff and also the inmates on those prisons. But anyway, and they said they run 16,000 tests, COVID tests. It's 4 times what they need if the whole population, inmates and the staff and everything. And the number is 62 deaths. In 5 prisons, you have more than a half what they showed from 1,451 prisons. The date something didn't match. I can't start to think which is one, and it's not make me sure to. And if I don't know the number, how can I plan my actions? How can I plan the budget? How can I work on it to if that data don't help me, how can I think a solution to work on it? And it's kind of hard. Next slide, please. Well, we are going to the questions which guide us to think our situation. And as you see, picture can show our prisoners are overcrowded. Carina already put a lot of those problems on the table. Elena also showed what is going on here. And it's just clearly for me, who work kind of behind the curtains and support to the government, to local government, work with the judges and people who work inside the prisons, it's a kind of a difficult situation. The reality was that the local and national government were apathetic about COVID-19 inside prison. It took time until we started the COVID contingency plan, considering the prison population, and of course, it's not effective. We were planning for outside people. The justice minister said, they are packed, they are locked, they're not going to get in problem. The first official COVID-19 positive case in Brazil was the beginning of March. But the first death was inside the prison. Outside was the first official COVID positive, but the first death was inside the prison. It was when the minister came on television and said, don't worry, it's just fine. We have to separate them. It's just one prison. And then a few weeks later, it came just a bomb, jumping numbers and numbers all the time. Next slide, please. Well, what is the problem? What we have when we see our prisons? It's impossible to adapt the basic rules of social distancing, mask use, hand hygiene, and those things are hard for us to take care. Our health service outside is not handling that situation well, and inside the prison it's worse. Water rationing, lack of hygiene and clean products, disease around elderly people, pregnant woman with babies, everything is in that overcrowded place. So we are dealing with a really complicated situation now, and the government don't release what we need about information to think about the problem. Next slide, please. So what was missing from the responses, right? The Minister of Justice and the Minister and the prison system, I put justice system here, the prison system, they're in the front line to deal with that issue. It belongs to the health system, despite the fact that prison health is by law under the Minister of Health. They kind of took it as a more legal approach than a health approach. And that is the big problem. In Brazil, it became more a political thing, how to manage the public opinion, than really take care of that situation. We are really in a situation really complicated around here. How did this manifest? The fast rise of COVID inside the prison. As a response to it, the National Council of Justice released a guideline to avoid mass contamination of COVID-19 inside the prisons, and the social educational system, which is a custodial system, is for underage people who have a problem in law. So we had, even that part is a blank. We had no news about it, and they're forgotten. I couldn't find anything. Of course, there's some guidelines and there's some numbers, and those guidelines and numbers are not clear. We are not sure what's going on, and it don't go to the news all the time. It has been on the news just once, and since March until now, they just appear once on the news, on the national news. The local news, here and there, you can see something. Next slide, please. Well, from the perspective, what we should do, right? For the next year, the implementation and use of telemedicine as a way of monitoring COVID-19 and other disease. The telemedicine in Brazil is not spread, not inside the prisons, and COVID just came to teach us that can be useful. The outside population, I have a lot of appointments with their physicians through the phone or internet and things like that. In Brazil, I think it would be cost effective if we push the government, negotiate with them and show them that we could put telemedicine inside the prison as a way of take care of prison health and strengthen the local prison health system. And for the next 3 years, strengthen the idea that prison health is public health through the dialogue with different organizations in the society. We don't see it as a public health and we don't talk about it. It's a kind of a taboo. No one wants to talk about it. No one wants to. It's a really complicated issue for politicians because it goes for public opinion. But it has to be clear that prison health is public health too. The problems inside the prison can go outside and the problems outside the prison can go inside. And they cross the lines, the workers go and come, and it's really complicated. And I think if we must talk to universities and create discipline on prison health and also internship program inside prison health service, that idea could start to change the people idea about it. How can I ask my student of med school to go to a prison to give a healthcare there if he don't know the system? He don't think about it. It's a really blank place. I felt like that when I started this field. So I think we should start to talk to society, approach our students, universities, government, and make prison health public health one. That's it. Thank you for your attention.
Thank you very much, Carlos. Fantastic presentation. Some really concerning figures there, but also some terrific insights. And we're continuing to get some great comments and questions in the Q&A. Everyone, please keep bringing those in. With no further ado, though, I'll move to our final speaker for today, Terry Norris Hackett from the ICRC, coming to us at almost 3 a.m. in Vancouver. Terry, I'll hand over to you.
Thank you, Stuart, and good evening, good morning, good middle of the night. It's such an honor and a pleasure to be here. I'm going to jump right in, so we can go straight to the first slide, please. As you heard from Elena, our teams have been supporting authorities in contexts around the world, over 60 contexts, and in regards to their support or their response to COVID-19 in places of detention. Although based in the Philippines, like Elena, I'll also be speaking from a generalized global overview based on the ICRC's experience and the 360-degree perspective that we've gained from working in several contexts during this crisis over the last several months. As part of our efforts, we've been entering into high-level dialogue with governments and detaining authorities and providing recommendations, technical advice, and material donations to support responses to the benefit of detainees. We've also been focused on the individual needs of detainees through the provision of support to restoring family links to help mitigate the impacts of the suspension of face-to-face visitation that's occurred in many jurisdictions around the world. And where possible, we've been using an adapted approach to monitor conditions inside places of detention, either remotely or our preferred choice through visits by our team, where we're observing strict infection prevention control measures and hearing the voices of detainees and the staff that are and their lived experiences. Next slide. So the key issues and challenges that we see, and I'm going to bring a bit of a different perspective, an operational perspective, that of a prison system advisor. And if you're not familiar with what a prison system advisor is we, there's about 18 of us in the ICRC, and we come from various backgrounds, but all of us have had management of places of detention, whether as directors, wardens, running multiple facilities around the world. So that's going to be the perspective that I'm going to bring here today. So from that, as we've heard from our other panelists, COVID-19 has compounded an already existing humanitarian crisis in many places of detention. As a colleague of mine observed, in many contexts, this is just another layer of despair placed on top of those that detainees were already facing on a daily basis prior to COVID-19. This includes overcrowding, population management issues, but it goes beyond the obvious critical issues such as social distancing and hygiene issues that we've heard about today, but also the lack of functional space inside a place of detention, no ability to quarantine on arrival or isolate, no such thing as home isolation. Prisons were not designed to manage pandemics, as we all know. The only space available to transform into isolation or quarantine areas are often recreational, educational, or vocational areas, but again, are all still critical to detainees' well-being. The mental health impacts of overcrowding for detainees are now compounded by the uncertainty and further restrictions of COVID-19, including the lack of family contact. When the crisis began, in many contexts, there was limited, if any, pre-existing connections with public health authorities, such as Department of Health or other agencies. Many prison health systems had worked in isolation for decades. This public health emergency has now forced systems to connect, but both have had trouble adapting, as Elena has talked about equally, I believe, on both sides, in terms of adapting to this new relationship and partnership. There's also a lack of coordination with the larger criminal justice system long before COVID. As we're seeing COVID-19 impact every aspect of the criminal justice system, arrests, sentencing, releases, resulting in even more of a challenge than it was prior to the beginning of this year. As a result, many contacts have struggled to manage the inflow, let alone formulate an integrated response to depopulation efforts that are necessary to manage COVID-19. Detention systems have most always been at the bottom of the priority for funding and resources by governments. And again, this is globally. Prior to COVID-19, there was already a lack of access to basic needs and services, as well as human resources to facilitate safe and humane detention. This includes health resources, as Elena outlined. From an operational perspective, prison managers and frontline staff were forced to rethink every part of the detention system, from intake to release and everything in between in a very short period of time. For example, detention staff now have to look at everything through the lens of infection prevention control perspective, which really wasn't at the top of any training for prison officers or wardens prior to maybe February, March of this year. And they had to make these changes basically overnight, like the rest of the world. This includes intake screening, quarantine, looking at food chain and feeding processes, access to hand hygiene points at every opportunity, continuing to find ways to access to fresh air if possible and safe, visiting. And another example, dynamic security. How can staff safely engage in dynamic security and feel safe doing so in a facility that has a COVID outbreak or even one that does not yet? Another example is releases under pressure to depopulate, but also having, I think, for many prison systems around the world, realizing that not only they have to respond to public safety concerns when considering releases, but how to mitigate public health concerns as well. Again, for the first time for many prison administrators. So everything's changed and systems have been forced to innovate. This includes forced innovation, such as technology that I think we've seen all around the world in terms of where possible electronic visiting, access to justice, e-hearings, even some very unique ways to send letters safely by scanning electronic and delivery, even a hard copy to prisoners in jail. But these innovations would normally have taken 3 to 5 years to introduce, but they were rolled out in a matter of weeks, or days, weeks, or months. They may not be perfect, but undoubtedly we've seen mistakes, but that is part of progress. And we've also seen innovative use of the limited space available in places of detention. Again, the repurposing of offices, vocational training and recreation areas for quarantine and isolation areas. Systems have also had to innovate in redesigning the flow of institutions, intakes, assessment, and other processes, as well as reallocating resources, both human and financial, to address COVID-19. Monitoring bodies have also been forced to innovate, and we've seen some great solutions both technologically and in the processes, such as hotlines, modified visiting approaches with the use of PPE, use of video technology, obtaining information about detention conditions from other sources, etc. If we move to the next slide, in terms of what has been missing from the response, many of the restrictions or new approaches that were designed as temporary are now protracted with no end in sight. There's now a need to, again, stop, reassess, and adjust accordingly for the marathon that C-19 will be. To do so, we need to get back to the fundamentals or the basics of detention and prison management. The Nelson Mandela rules, the Bangkok rules, and others can serve as a roadmap for detention systems in addressing COVID-19 while maintaining the critical framework of the minimum standards within a place of detention. When you look at them closely and through the lens of COVID-19, it's evident that these minimum standards are more relevant than ever now than ever before. And collectively, we must find a way to balance public health against these minimum standards. Another area that's a cornerstone of good prison management and has been missing in some context is effective internal and external communication. As we heard from Carina earlier, communication about C-19, why things are changing in place of detention, what is happening in the community. These are all critical things that need to be shared with detainees, and we've seen some gaps with that. This is important in all places of detention, but especially critical in immigration detention centers where the information needs to be shared in a language that's understood by the detainee. And this point can also be made in terms of external communication that's critical that detaining authorities are transparent with the public, families of detainees, as well as public health entities on what is going on behind the walls in relation to COVID-19. This brings me to my second point of what, from my perspective, is missing, and that's a consistent community, both national and local response. Detaining authorities in many contexts have been largely left on their own to address the public health crisis that's entered the prisons. This includes prevention and management of COVID cases without links to larger government policy decisions on COVID-19, as well as connections to vital community resources such as testing or additional healthcare staff deployment to places of detention with outbreaks. Another concern related to the larger community response is the need for safe release pathways for detainees during lockdowns and community restrictions. This includes community support for various safeguards, including continuity of healthcare for those without family support, provision of accommodation, as well as basic needs. You can imagine detainees need to be provided this essential information about how to navigate the new COVID-19 world when they're released in order to, for depopulation efforts to succeed. And before I proceed to my final slide, I'd just like to reiterate that, again, not all contexts are missing these two elements. I'm speaking from a global perspective. I'm sure there's great examples, and I have heard of some that where one or both are being applied. But overall, from our perspective, the good examples seem to be for these two areas in terms of communication, getting back to the basics. They seem to be an exception rather than the rule, again, from globally and generally. The final slide here, in terms of priorities to respond sustainably and effectively. So for 3 months, again, it's interesting to look at 3 months and 3 years. 3 months seems like 3 years, so 3 years now seems like 10 years. So just even trying to put my head wrapped around these was an interesting endeavor. But from 3 months perspective, again, to respond sustainably and effectively, we need to first understand how COVID-19 has impacted detainees and frontline staff in places of detention by listening to their lived experience through this crisis. The need for monitoring bodies, internal inspection processes, academics to adapt and gather and share this information so that systems can adjust and better meet the needs of detainees, while at the same time keeping them safe from COVID-19. It does not need to be an either or. We can do both. We also need to stay focused on COVID-19 and not take our eyes off this threat or become complacent. We must all continually improve and adjust our response. I feel we're at a critical crossroad right now, the struggle between continued emergency response with the first or second wave versus transitioning into a better normal. If we get stuck between these two phases, there is a real risk of complacency. Also in the next 3 months, efforts need to be made to systemically start tackling the stigma associated with COVID-19. We've heard it from several presenters. This includes stigma targeted at both detainees and prison staff. This is critical for both the mental health for both cadres, as well as in order to ensure there's no roadblocks in the way of safe release pathways, or even for human resources reporting to places of detention. And with 3 years, again, very happy to think that far out right now, is to continue to build on unlikely opportunities. That's those opportunities that before COVID-19 didn't seem realistic or possible, at least in the foreseeable future. So this includes new partnerships, the strengthening and integration of prison and public health systems, and the forced innovation I referred to earlier. All of these efforts need to continue beyond the initial emergency response phase of this crisis if the detention system is going to emerge into a better normal. And finally, COVID-19 has been a wake-up call to authorities. At least it has the potential to be, but governments need to listen to that call. And to have sustainable response to COVID-19, we need to address the factors that are contributing to the devastating impact we are seeing of C-19 in places of detention. And again, those factors aren't new. Overcrowding, aging, infrastructure, access to healthcare and basic needs, the pre-existing humanitarian crisis in places of detention needs to be addressed if we're going to efficiently and sustainably respond to COVID-19 and detention in the next 3 years and beyond. Thank you very much.
Thank you very much, Terry. You covered a lot of ground in that time. There are lots of great points there. One that struck me was that phrase of transitioning to a better normal. Hopefully we can have some time to explore the ways in which we might do that moving forward. We have just under half an hour left. And what I'm going to suggest now is that Louise take the floor and try to communicate to us some of the questions and comments that have come through. There's been quite a few. What I might do towards the end is just invite each of our panelists before we finish to, in 1 minute, give us any final reflections or comments based on what they've heard the other panelists say and based on the discussion that we're about to have. So over to you, Louise.
Okay, thank you. And thanks to all the panelists. I'll just give you a sense of the sorts of questions, and then you might have the panelists will have an opportunity to maybe think about the answers before we put you on the spot. But we've had a couple of specific questions for WHO. For example, around whether the guidelines for preparedness, control and prevention have been translated into other languages, in particular Spanish, for example, and that might also be a question for ICRC, I'm sure, about whether there's opportunities to access your materials in different languages. Also some questions coming through that are a bit more sort of for all panelists about the strategies of engaging with prison departments or prison authorities in member states. How can people effectively engage with these authorities in order, for example, to get reporting about prison conditions? Is there a requirement for each country, for example, to report about their conditions to WHO has come through. And there's several questions about, are there models that are considered best practice or that you have noticed have been outstanding, or on the contrary, are there models that should be avoided, for example, where it's clear that we shouldn't be following a particular approach? That we might start with those ones. There's more to come as well. We've got some specific regional questions as well, but perhaps we'll start with Carina and some of the questions for WHO. Can we start with the easy ones, perhaps about languages and access to materials?
Thank you very much, Louise. And we provided some answers also because it facilitates, that everybody has access. Together with ICRC, we have we have discussed the possibility of having WHO materials translated into additional languages than the ones that we have. We have it available in Russian and in English. We have also, with the government of Switzerland, available translation in German, Italian, and French. And with ICRC, there were some plans also to translate it into several other languages so that this could be more global. So Elena, maybe you can say a little bit about this. Thank you.
Yeah, thank you, Carina. Yes, indeed. And they are these three other languages. It's Spanish, Portuguese, and Arabic, and it's done, and it will be available in a couple of days' time on online. So I'm very happy to announce that.
Great.
Thanks.
Fantastic. Can we turn to the question about whether there's any obligation on countries to report information about their prison health, in particular their COVID-19 status, to WHO or to other agencies?
Thank you, Louise. I have given a reply on this by written. Basically under international regulations, countries are reporting to WHO. The issue is that the data is aggregated and we do not have access to, to disaggregated data. We are in a very complex situation where, it is very difficult. And of course, everybody that works in data knows how this can be, difficult to disaggregate, or to collect, data from different sources and then to aggregate it or, or to provide different, So we, unfortunately, we do not have, this disaggregated data. And again, because of that, we have created this platform that can be used by several countries, to report to us on, just focusing on prison health settings. Also, we understand that many of these are managed by Justice, by Ministry of Justice. and they have different monitoring systems. So again, you know, although they should be reporting to Ministry of Health, as it was mentioned here, there's a challenge in terms of communication, in terms of reporting. And then, as I mentioned, you know, the issues of security also, and I think it was already mentioned here by Brazil, by our colleague, that you know, it's difficult. It's systems that are not used to working with data, and again, the security issue also needs to be brought into discussion. So we understand all of that. These are challenges.
Thanks, Carina. There's a question for all of the panelists on a really important issue. Can the panel comment on the issue around managing children's rights across youth custodial settings? This is something that Carlos mentioned, but it would be good to hear from all our panelists if possible.
I'll just open it. The custodial system for underage adolescent people, it's in Brazil. It has the same characteristics of a prison. Of course, a little bit more education inside and things, but the health system is still weak. I think because of the number of those people inside the social educational system is smaller than the prison. We should had a chance, or we should do something, because we had a chance of doing a better approach than we do inside. Lack of test all of them, give them test for COVID, positive for COVID, the management of them, the release for home custody under the maybe the use of electronic device, those kind of approaches, things that can put them in a better position. We are in Brazil, that area is blank. I tried to find something about it, but I couldn't. I just see the legal and the news that thing that can kind of ease you down. No, that it's just okay, but can't make you think of what's going on really. You don't know the data, you don't know what is happening. You just know it when it's exploded on the news, and it's kind of a complicated situation here in Brazil.
Can I invite any other panelists who'd like to comment on the issue of youth, of dealing with the issue of COVID and youth detention?
I can briefly touch on it, and I think it's coming back to something I said in my presentation about getting back to the basics, and again, you know, looking at really what the first question we need to be addressing it is, again, out of the Havana rules, ensuring that detention of juveniles is the absolute last resort. Again, as we heard a moment ago, looking at alternatives for alternatives to incarceration, but also I think this is I think an area that is missing in the response, that I don't think any of us touched on as one of those gaps, and I think it's something that in the clamor of all of this, unfortunately, I think we need to apply the same equal opportunities as we're seeing for support to juvenile justice facilities that we are providing to adult, and if not, and go beyond that. But again, I think it's something that it's a gap, and I think it's a great question. I don't have the perfect answer other than coming back to some of the basics of ensuring that again, detention and decarceration is looked at as an absolute priority.
Great, thanks. Okay, we might move on to another question. Several people have raised a question about how do we balance the human rights of people in detention with what is becoming the new normal, which involves some people being isolated more or locked down more with less access to basic facilities, and how can minimum standards be returned to in a way that also is consistent with managing the risk of infection? It's obviously a very difficult question, so we'd love to get your wisdom on that. maybe Elena, sounds like it's one for you, I think.
Yes, okay. I mean, it's a difficult one, and as I think many questions that are asked today. Well, I mean, it's how to balance it. I think there are the minimum standard rules should be applied at any times. I mean, this is, I think, the leitmotif, the key message that we need to keep in mind and to remember. So there are no different different rules in times of COVID or in the normal times, let's say. Then, of course, what is important is to the balance that rights and the public health imperatives in detention. For me, if I may put it this way, the rules should be respected, the rights of detainees should be respected, the measures that are put in place should be proportionate, and that they should be aligned with the measures put in place for the community. So it's once again the principle of equivalence. Maybe it will be, I can illustrate it with some an example. For example, in some countries, the government put in place, decided to introduce a mandatory use of face masks, medical or tissue mask for the population. And some prison authorities, they think that, okay, this public health measure needs to be replicated in the prison. But the prison reality is different, and what we are asking people to do outside, we can't fully replicate in the prison system. The use of mask outside detention, for example, it's in a limited period of time in a certain, let's say, areas, spaces. This could be a measure dictated by a public health imperative to put in place. But we can do the same. We can use the mask in the prison system, inside the prisons, but to consider that the prison is an overcrowded place. It's a public, the space where you can't ensure the physical, let's say, distancing. So then prisoners, they should wear a mask 24 hours a day. So this is disproportionate, and it definitely should not be implemented this way. So it's really, I think this balance is should be respected and ensured that for any public health measures which are introduced in the community and then adopted to prison setting and prison realities. And once again, the minimum standard rules or Bangkok rules or Havana rules are applicable at all times, and this should just go hand in hand. And I don't know, Terry, if you can have anything to add to what I said, please go ahead.
No, other than I know this is, as I said, we're right at that point where we need to stop, take a breath, and look at this. These temporary measures aren't temporary. They are now longer term. When detainee authorities were putting in place all of these issues, these restrictions, again, they were, I think, for many that I've talked to around the world, they were looking at a month out, maybe 6 weeks, maybe 8 weeks. Now we're seeing it as the crisis has evolved. It's a marathon, so it's time to step back, take a look at those assessments, exactly what you said, Elena, what's proportionate, and that I really like what you said about the principle of equivalence in terms of what is happening in the community, and we call principle of normality, what's happening in the community, to that extent. Again, you can't mirror it all, but it needs to be proportionate to what's happening there as well. So there's no one answer. It'll depend on every context, what's happening in the community that surrounds the prison. So that's why it's even more important to connect those community resources so that, I saw one question here that asked, is the dismissal of basic minimum standards acceptable even in the light of trying to control the pandemic? And I would unequivocally say absolutely not. I mean, it needs to be looked at case by case, of course, and addressed, but for the least restrictive amount of time available, and also the least restrictive amount of restrictions based on that threat. And again, listening to health professionals, working hand in hand with prison directors and finding that balance. And I think that partnership will be key moving forward.
I would like to add just one point. For example, Brazil is the third biggest prison population in the world. It's over 700,000 people inside there, and 40% of those people are waiting for their trial. They're inside prison, but they didn't have passed the judge, and they know their sentence yet. Home detention, the use of electronic device, anything else that could help to release a little bit of pressure inside the prison should be done. And I think that could be our approach. The basic rule, like everyone is saying, the basic rule, we have guidelines, and because of some countries, the justice system is in charge of everything inside the system for prisons and everything, that they don't have the approach of a health system, a health professional, and they deal it as a legal issue. They just want to know if they release, what's going to be the problem outside, and if they don't, what's going to happen. It's just a matter of legal management of a situation which is about health. And of course, those two universes have to dialogue with each other. The legal side of that conversation and the health side of that conversation, they should be on the table, and they should try to find, there's no one size for all solution. There's a local solution. Maybe that solution would be in that town, they have one jail, one prison. That solution going to be for that state. That solution going to be only for that country. But the dialogue is the key. We need to dialogue. We need to talk. A university has a lot to give about the technical approach, about how to deal with data, how to collect data, and the justice system, the health system should be on holding hands to try to find a solution. The problem is outside, the problem is inside, and the COVID-19, just to show the whole world, we weren't prepared for such thing, and we are all in the corner, and people who is inside the prison is more. We should do something about that.
Carina, is there anything you'd like to add to this question?
No, not really. I think that the main elements have been already referred to, but I would like just to, to come back to the issue of human rights that have been, highlighted over and over here in all the topics that we are covering. A public health response does not mean that we have to choose between one or the other. It means that we have to, to consider that within the framework of human rights, we need to integrate a public health response. So I think that this should be, very clear to, to everybody. We know that there's a lot of challenges to understand, the limitations, and to understand also that this is a situation that came to stay, unfortunately, for the moment, and this will imply that there are changes that need to occur, and it is, I think, an opportunity, as many have been saying, also to relook at the systems, to relook at the lack of coordination, relook at some of this human health and human rights issues that for long, all the agencies and all the civil society organizations have been, highlighting. And I think that we are very happy that we are collaborating with our partners, with the universities, and we are trying to, WHO is trying to have a collective approach, a solidarity, approach, so that we can sort out some of the issues which are related to our communities, and this includes prisons settings. Thank you.
Great. I think we've got time for one more question, and there is one that links quite nicely with what you've just been saying, Carina. So perhaps I'll throw this one to the panelists. It says, It's a question about the international coordination on this sort of response. The question is, it seems that WHO, ICRC and other UN agencies such as UNODC and other organisations are all supporting different countries for preparing for responding to COVID-19. Is there any kind of coordination in place about this to cover as many countries as are in need, or to support national authorities? That might be one for you, Carina.
No, I would like just to say that we're talking about also different levels and different responsibilities in time of, the way that the response is provided. WHO, is a public health agency which mandate is, given by the member states, and it's basically linked to, to providing some guidance and, policy support. But we do not have, this feature of, working in the ground except in emergency contexts. So we are, in fact, working with partners, and ICRC here present is, of course, one of our partners, and, they have a lot of work in the ground, and they are essential for, these responses. So we try to coordinate as we can. It is true that there are, many challenges in this response. And again, this is an opportunity for us to improve this coordination and to understand the roles and the limits also from each of the agencies and the organizations. So I'll let Elena develop a little bit more.
Thank you, Carina. You answered so nicely and so comprehensively this question, and I really don't have anything to add. It's exactly, we are operating in the frame of our respective mandates, and for the ICRC, this of course with the respect of our fundamental principles of the movement and the organization, which is among which is the neutrality, impartiality, and independence. So I mean, for those who are familiar with the organization, this is not new, but of course for in the areas that we need to coordinate and to exchange with other partners, be it WHO, but also the national societies working, I mean, in different countries, active or not, in detention. Of course, it's done, and well, I guess we can, we should, do more and better. But it's there, the mechanism, and we should continue in that direction in working together. Because as it was said by the WHO, the COVID is. We need to be united to really to fight against COVID, be it in detention or globally. So this is the way to go. Thank you.
Great. Thanks, Elena. We've run out of time for more questions, but just to say on that issue about the balancing of role, the maintaining of rights and the practical solutions to responding to protection of rights, our next webinar will be about decarceration specifically and looking at some of the challenges around that. So we'll be able to dig into that aspect of it more in a month's time. So I'll hand back to you now, Stuart. Thank you.
Thank you. And look, once again, thank you so much to our panelists. As I said before, we're almost out of time, and in the interest of keeping to time, can I invite each of you to, in a maximum of 60 seconds, provide any final reflections or comments that you'd like to share with us, and we'll go again in the order of the presentation. So first for you, Carina.
Thank you, Stuart. So, I mean, my final reflection is that we should face COVID-19 as an opportunity to relook at our systems and really build from this to improve the response that we have in these areas. Again, these children and the youth deprived of liberty is a very important topic where there is a clear gap, and we take note of this. Thank you very much.
Thank you very much, Carina. Elena, over to you.
I guess it's fun. Well, joining Carina in that message, it's absolutely crucial, and so again, it was a very challenging time, but an opportunity, a real one, to make invisible visible, to stronger advocate for better prison health, be it COVID and beyond COVID. It's because we should not forget about all other health conditions, problems, access to health care in detention. It's not only about effectively tackling and responding to COVID. We have non-communicable diseases, we have other communicable diseases in prisons, and this is the momentum that we should really work come together and work together and join all our efforts, and in a concrete manner. It's not only in a symbolic way of it, but really concrete actions. So thank you very much.
Thank you, Elena. Carlos, any final reflections?
Yeah, like Elena said, there's before, a few months ago, we were struggling TB, HIV, hepatitis inside the prisons. We are thinking about how to face those problems, and COVID came and showed that we are really, really not prepared. We all around the world, we have the same problems, but different tools to deal with that one. My advice would be try to do it local and watch what people are doing outside. Try to learn from their experience. That's what I have been trying to do, and that's why I work. I try to take advice from WHO, from WeTrain, from universities and colleagues all around the world where I have colleagues dealing with that topic. And from their perspective, their way of see that subject, I try to build out solutions in my local reality. Try in your place to see whose authority is trying to do something. People sometimes they struggle because they don't have anybody to even talk about it. So the moment is to learn from each other, to help each other, to support each other, and to try to bring any discussion or solution about the topic. It's really great to be part of this panel, and thanks for everyone who's watching it and collaborate with their passions and push us to think further the problem we have right now. Thank you so much.
Thank you, Carlos. And finally, Terry, any final comments?
Well, just to echo all of the great panel's comments, I think to build off of Carlos, you mentioned there about local solutions. I fully agree, and I think there's no one size fits all, but a key piece of understanding what those local solutions would be, of course, looking at where there's best practices, looking at guidelines, but we can't forget to listen to the lived experience of detainees and those people that are working inside of the prisons as well, because we're seeing some great innovation that's coming with them even working together to address this. Because I think as of any time in the history, or in the recent history anyway, I think detainees and staff are also seeing that their fates are together in terms of a health perspective. Is COVID-19, I always said when we were talking about TB, that TB doesn't know the difference between a lung of a prison director and a lung of a detainee. And same with COVID. Everybody's equal. It brings us that great equalizer in terms of our vulnerabilities. So I think, again, listening to those lived experiences are a key part of moving forward and finding those local solutions. Thanks.
Thanks, Terry. And if I could just very quickly add, I mean, there are so many issues raised in this webinar. We could have kept going for the whole day, I think, but I want to thank all my panelists for compressing a lot of very important information and thoughts into a short period of time. One thing that still sticks with me is this, I'm stealing your words again, Terry, the idea that COVID-19 in places of detention is just another layer of despair, and that moving forward, there may, a silver lining here may be opportunities for us to think about ways to improve the situation for people in prison and youth detention and immigration detention, and COVID-19 being an impetus to try even harder to achieve those reforms that we so desperately want to see. Before wrapping up, I want to just remind everybody about the other 5 webinars in our series, one happening each month for the rest of this year. As Louise said, the second one, talking about opportunities for reform, is focusing on decarceration in the context of the COVID-19 pandemic. For anybody who's interested in attending, I'll invite you, if you've registered for this, you should receive an email with the details of that. You should also be able to find it on our Justice Health Unit website, and you can follow us on Twitter, JHU_UOM, and we'll certainly be tweeting the details there. So just in wrapping up, I want to again thank our 4 fantastic panelists for giving so generously of their time. It's been a fantastic session. I want to thank you very, very much for taking the time. To Louise and the team, thank you very much for the enormous amount of work that you've done to bring this together. And lastly, to our audience, thank you so much for joining us. Thank you for the many comments and questions. I'm sorry we didn't have time to get to them all. Our group will certainly look over all of those questions and they will inform how we approach the future webinars in this series. And with that, I want to thank you all very much again and I bid you good night, good day, good morning, whatever time zone you're in at the moment.
Thanks.
Thank you.